Canada's healthcare system. Throughout this presentation, we will talk about 6 main points that make our healthcare system one of the best. First of all, we have Medicare. Free medical treatment available for all Canadian citizens as well as all permanent residents. Areas not covered by daily care include ambulance services, prescription medication, and dental work. Reforms have been made and will continue in response to changes within medicine and throughout society. The basics remain the same: universal coverage for medically necessary health care services provided on the basis of need rather than the ability to pay. On the other hand, we count with 5 Healthcare Act principles. Number 1. Public administration. The provincial and territorial plans must be non-profit. Number 2. Comprehensiveness. The provincial and territorial plans must ensure all medically necessary services provided by those working within a hospital setting. Number 3. Universality. The provincial and territorial plans must entitle all insured persons to health insurance coverage on uniform terms and conditions. Number 4. Accessibility. The provincial and territorial plans must provide all insured persons reasonable access to medically necessary services without financial or other barriers. And number 5. Portability. The provincial and territorial plans must cover all insured persons when they move to another province or territory within Canada and when they travel abroad. By now, you may be wondering, but how does it work? Instead of having a single national plan, they have 13 provincial and territorial health care insurance plans. Under this system, all Canadian residents have access to medically necessary hospital and physician services without paying out of pocket. The provincial and territorial governments are responsible for the management, organization, and delivery of healthcare services for the residents. Roles of the provincial and territorial governments in healthcare system include the following: administration of health insurance plans, planning and funding of care in hospitals and health facilities, services provided by doctors and other health professionals, planning and implementation of health promotion and public health initiatives, and finally, negotiation of fee schedules with health professionals.
Private clinics are not legally allowed to provide services covered by the Canada Health Act, but many do offer such services. The advantage of private clinics is that they typically offer with reduced wait times compared to the public healthcare systems. Private clinics are a subject of controversy, as some may feel that their existence unbalances the healthcare systems and favors treatments to those with higher incomes. Recent changes: primary care. Aging population, rising rates of chronic disease, and other changing health trends have emphasized the need for healthcare systems to maintain and continue to develop the capacity to respond to changing needs of Canadians. Reforms have focused on setting up more community primary care health centers that provide on-call services around the clock, placing greater emphasis on promoting healthcare and managing chronic diseases. E-health. Electronic health technologies are significant drivers of innovation, sustainability, and efficiency in the healthcare systems by providing access to services, patient safety, quality of care, and productivity. The implementation and use of electronic health records contributes care renewal by facilitating the integration of services amongst care providers. Wait times reduction. Provincial and territorial efforts to reduce acute care wait times in accordance with priorities of their individual systems include training and hiring more health professionals, clearing backlogs of patients requiring treatment, building capacity for regional centers of excellence, explaining ambulatory and community care programs, developing and implementing tools to better. Patient safety includes the avoidance of medical errors of adverse events, one of the most significant issues facing health systems globally, and a growing aspect of Canada's efforts to improve quality healthcare provided across the healthcare systems. The federal, provincial, and territorial governments are continuing to work with healthcare professionals, organizations, and institutions to mitigate the risk involved in the delivery of healthcare. Prosperity Index Survey. Legatum Institute carries out a huge survey that ranks the most prosperous countries in the world. Health is measured by three key components: a country's basic mental and physical health, health infrastructure, and the availability of preventive care. According to the list, Canada is on place 16. Lack of doctors and nurses in Canada. Recently, there has been a shortage of doctors and nurses in Canada. Some feel that Canada's healthcare system does not adequately compensate healthcare providers. This has led to a brain drain of Canadian doctors and nurses, which have led Canada to pursue careers in the United States. Attracting and keeping skilled medical workers is a priority if Canada is to able to provide proper medical services.